Hello, I'd like to welcome everyone to the PartSource HTM Leadership Series. Today's presentation is the fifth of our 7-week series that will continue weekly through November 12th. Today's session, Unusual Times Call for Bold Changes in HTM-Related Professions, will be presented by Stephen Grimes and is hosted by Guy Mancetto. Now please allow me to introduce Guy Mancetto. Guy Mancetto joined PartSource in October 2017 as Senior Vice President and Chief Marketing Officer. With 25 years in the healthcare industry, Mr. Mancetto brings expertise in healthcare technology solutions for provider, payer, and employer markets. In this capacity, Guy leads efforts to help accelerate growth and facilitate development of medical supply chain solutions and service models designed to increase innovation around utilization and uptime. Now I'll hand it over to you, Guy.
Thanks, Colleen, and thank you all to those who are joining us today. At PartSource, we really believe in shared learnings, best practices, all in the effort to help advance the clinical engineering and HTM community. And I'm really super excited about today's session and our presenter for today's session, Unusual Times Call for Bold Changes. To help present, I'm thrilled to have with us today, Steve Grimes. I first got introduced to Steve after having a chance to read Amy BINT article called C, Clinical Engineering, HTM Professional Roles in Healthcare Delivery, Time for a Trajectory Reset. The article discussed how changes in healthcare technology required a fundamental change in clinical engineering and HTM services, including the knowledge, the skills, the abilities of HTM professionals in order to be successful in the future. And that article, in fact, won Best Article of the Year award from Amy and the Viability Journal. So we are in good company on this topic. Given today's challenges, the industry has only accelerated and created an onus to accelerate the change in the field. So I am pleased to introduce Steve Grimes. Steve has over 40 years of experience working with independent service organizations and academic medical centers. He's recognized authority, frequent speaker and author on topics ranging from future challenges facing technology support industry to healthcare technology convergence, medical device security, risk management, quality management issues. And he's been involved in the development of many industry standards and have served as an HTM consultant to the World Health Organization and the Pan American Health Organization. He is a fellow of HIMSS, Amy, the American Institute of Medical and Biomedical Engineering, and the American College of Clinical Engineering, where he's also past president. It is my pleasure to introduce and welcome Steve.
Thanks very much, Guy. Okay, very good. All right, well, thank you. And I'd like to thank also all of our friends at PartSource for the opportunity to speak with you as a part of PartSource's leadership series. I think it's great that they offer this. And then one of the things that you'll see in the that I talk about in the presentation is going forward, continuing education is going to be a critical aspect of something that something we're going to need to continue to work on. And I think it's great that PartSource is offering these great programs to keep you up to date in terms of what's going on in the field. So in this session, the first area I'd like to touch on is the nature of the relationship between evolving medical technology, the services that are going to be required to support this technology, and what are the capabilities that are going to be required of clinical engineering and HTM professionals. So the most important point I'd like to get across in the presentation is that new HTM services and clinical engineering and HTM roles are both defined by the support requirements of the new technology that we're dealing with. And since many of the new technologies we're dealing with are very different from what we've been dealing with in the past, the support services and the professional staff, the support staff must also be different. So what makes these new technologies so different? Well, if we take a look at the trends, we're seeing that there's increasingly converging technologies, particularly those related to medical information and telecommunications. We're also seeing an increasing complexity, technology complexity. Today, we've not just technical systems, but the evolution of systems of systems. And also medical technologies, like so many other technologies we're dealing with today, including consumer technologies, have become smarter and more software based. So what does this mean for those who are supporting these technologies? That is the HTM professionals. It means that their roles are required to evolve and change corresponding to the evolution of that technology. The old approaches to support traditional technologies don't necessarily work anymore for the new technologies. And the rate of change that's taking place, because these are happening, these things are happening very quickly, means that the HTM community, the professional community, must prepare for continuous education if they're going to ensure that they're staying relevant. So hardware technology significantly will continue to evolve at faster rates. And with the new paradigm, there is a need for new services and new tools to deal with that technology. And with those new services, new tools, of course, we require that the support roles, the CE HTM roles, have new knowledge, new skills and abilities, or KSAs. So existing HTM practitioners should consider their future viability and success is not a certainty. I suspect that blacksmiths once thought that there'd always be, some need for people of their capabilities many years ago. But the truth is that there are few certainties if we as professionals, as a profession, don't evolve. The potential is, our profession can die off and be replaced by others more capable of evolution. So this is it's a cautionary warning. This chart's meant to illustrate our challenge. It shows the relevance on a vertical axis and the time along the horizontal. This part shows how we've evolved from the old HTM clinical engineering paradigm, how we've grown in terms of our relevance over a period of time. And we've come to and are passing what's considered a strategic inflection point. So today, as we've approached this point, if we keep on with the status quo, our profession and are prepared to make considerable changes, we can lose relevance and can be doomed to failure. However, if we do make the necessary changes and embrace a new, more relevant paradigm, we can realize success. But we've only got a limited time in order to, for this opportunity, to realize this opportunity before course correction becomes impossible. And this is just meant to illustrate that, again, before, we have a relatively short period of time from today to go and to work on this, or to solve this issue or address this challenge before, if we don't, then we just become irrelevant, and the technology support needs to get taken up by others. So in this next section, we're going to take a closer look at how medical technology has evolved over the past 30 to 50 years. 30 to 50 years ago, the vast majority of medical devices tended to be simple, discrete, and unconnected. They were typically single function, diagnostic, or therapeutic devices. The support services, the HDM support services, tended to cover, they tended to be relatively basic. They included things like inventory, doing inventory systems, work order system management, safety testing, maintenance, and managing compliance, and maybe doing some pre-purchase, providing some pre-purchase advice. But they tended to be fairly basic services because, again, the technology was relatively basic. And those support services were typically delivered by clinical engineers who basically had electrical or mechanical engineering backgrounds that may have been given some education in anatomy and physiology, and also maybe on the medical equipment management. And they were also supported by the biomedical equipment technicians who had basic electronics and medical equipment troubleshooting training. So over the past 30 years, with the evolution of increasingly computerized and connected systems, we've begun to see the evolution of hybrid systems. That is, systems that are not only medical technology, but they've also incorporated elements of information and telecommunications technology. So this is what we're seeing in terms of a new generation of equipment, often is, or healthcare technology equipment, are hybrids of these other systems. Because the overlap in traditional HTM and IT support services is often not seamless, this poses a particular challenge because it often is not clear whether a particular problem or an issue is related to the medical technology elements of a system, or instead maybe related to the IT or telecommunication technology. It's also a challenge for our customers, the people we support, the clinicians who are having technical issues, because it's often not clear to them, is this a problem? Who do they contact? Is it a problem with, if it's a problem with the device, do they go for HTM assistance or IT assistance? And frankly, it's not a choice we should be asking clinicians to make. So you think in terms of eventually we need to be considering when clinicians, when our customers have problems, they should just be able to go to one source and have that one source resolve the problem, whether it may tend to be more medical or IT related or telecommunications related. So it kind of speaks to the need for things like service desks, shared service desks. So as we move into the near future, medical technologies will continue to evolve. Most medical device manufacturers today admit they're becoming primarily software developers. Whenever possible, more medical data processing and storage will be moving from local devices and networks and eventually up into the cloud. The reasons for this migration is that you get greater efficiency, increased availability to users, regardless of where those users are based, better management, and better security and backup if you can migrate your processing and storage essentially to one location, or having it maybe in multiple locations, or master copies kept in multiple locations, which you can do up in the cloud. So after moving the data processing and storage to the cloud, the remaining hardware for many medical devices will be like the slim clients that IT talks about, and it'll largely be diagnostic sensors and therapeutic actuators. So another trend that's growing is the integration between the diagnostic and therapeutic systems, and the use of decision support and expert systems to augment the clinical practitioner's own knowledge. The idea for this is not new. It's if you think of the AEDs, the automated external defibrillators, they combined a monitor, which is a diagnostic device, a defibrillator, which is a therapeutic device, and also essentially a basic clinical decision support system, which could detect the fibrillation or asystole without having an actual physician or nurse intercede. So other systems, therapeutic systems, monitors and things like monitors and infusion pumps, for example, they'll continue to get combined with clinical decision support systems. And these systems will be further integrated into patient and medical records. Some of the other trends that we're seeing are the migration of healthcare delivery from traditional venues, hospitals and physician offices, with more care being delivered at home, at school, and at work. One of the effects of the current pandemic is that it's accelerating trends like these. Many of the legal, financial, and practical barriers to telehealth are being eliminated as a consequence of this, and really kind of proving the effectiveness of telehealth. So as I mentioned, the COVID-19 pandemic has taken many of the trends that were already in progress and accelerated them. State governments who put legal and reimbursement limitations on telehealth have now eliminated many of these technical capabilities. Some of the technical capabilities to accurately diagnose and treat patients are gaining wider acceptance, including things like remote monitoring. And there's also, we're seeing additional capabilities taking advantage of remote device management capabilities are also improving. So another trend that's been underway for some time, and that will certainly be accelerated as a result of this current pandemic, is the hybrid support model. This involves augmenting on-site support with support from remote experts. Traditionally, this may have been phone support, automated or telephone support. But what we're seeing is now more of this is being done over the internet. So it may include the use of remote diagnostics for troubleshooting. It may include the use of other technologies or equipment to update software, and as well as other technologies like augmented reality support to provide advanced technical support. Yet another trend that's being accelerated by the pandemic is changes in our training and educational delivery systems. Traditionally, we had the colleges and universities for academic education. We had employer and vendor training centers for operations and tech training. And then we also had, the professional industry conferences like the, AMI for continuing education. We've now seen that these academic programs and professional conferences are being forced to cancel their on-site activities and forced to develop off-site and remote alternatives. Going forward, we should look for more individualized training and education using online and on-demand programs. This approach is going to allow for more timely updates to these services and will provide greater flexibility for those, for the students, for the learners. Next, we'll address how these gaps have developed between, how the existing gaps have developed between the support needs for these new technologies, the HDM services as they exist today, and the knowledge, skills, and abilities required of the HDM professionals. So examples of some of the evolving technologies driving the future of medical devices, and this is on the leading edge, but again, we'll continue to see more of these, and they'll continue to play greater roles, are things like the robotics, 3D imaging and printing, telemedicine, the remote monitoring, development of micro and nanotechnologies, individualized medicine, connected systems of systems, and cloud-based solutions, clinical decision support and expert systems, and artificial intelligence. So robotics, 3D imaging, telemedicine, connected technologies, and nanotechnologies will enable us to diagnose and treat areas we previously could not access because of distance and other limitations that the existing systems have. Things like 3D printing and genomics will enable us to diagnose, customize much more effective treatments. And clinical decision support systems and artificial intelligence are going to allow us to access and accurately apply a vast array of knowledge in ways not previously possible for any one group of practitioners. These all represent advanced technologies that require new HTM support services for professionals who have the appropriate skills. So in this chart, we look at the evolution of healthcare technology, that is, its increasing capability and complexity over time. We compare the evolution of healthcare technology with the trajectory of CE evolution. So you can see up to this point, up to today, we largely have been on track with respect to the technology evolution. The major challenge we have is we are beginning to see that this technology evolution is becoming a hockey stick curve where it rapidly accelerates as time progresses. And we're beginning to see the evidence of that acceleration of that curve. The challenge we've got is that if we continue the development of our skills, our abilities, our knowledge at the same rate we've been doing, we're going to not be able to keep up with the converging and increasingly capable and complex technologies. So we need to be prepared to do a trajectory reset to better align ourselves with where these technologies are going if we're going to be able to effectively them. So now we'll consider some of the support services that are required for the new technologies. What are some of the support services that professionals are going to need to be able to provide? First we'll take a look at in the first group of services here represent the more traditional services, covered by healthcare technology management professionals. They include things like maintenance services, regulatory compliance, inventory and work order management, and safety services. The new services that we need to get serious about, the ones that are for advanced support services, include things like life cycle and asset management, systems engineering, dealing with the management of systems, including the integration of those systems, cybersecurity management, dealing with integrity, availability, and confidentiality of data when in motion or at rest. Risk management services, doing risk management, doing analytics. What are the analytics of usage? What are the analytics of incidents and problems? So getting better at analytics, getting better at incident and problem management. And when we talk about incident management, we're talking about essentially a device failure is an incident, but a series of device failures of a similar nature is a problem. And that's how IT typically defines it. And then project management skills, and other specialized skills that involve things like the robotics and 3D and AI and AR. So now I'll speak to some of the necessary professional roles required, as well as the new knowledge, skills, and abilities required. When we look to generic technology support programs, we'll see that an effective support requires three types of professionals: the engineer, the technology manager, and the engineering technician or technologist. So again, whenever we're talking about any type of technology support, basically the paradigm involves the participation of three types of professionals, and that's true in in the services we offer. So when we talk about healthcare technology support, we're talking about the need for clinical engineers, healthcare technology managers, and biomedical engineering technicians. So in this slide, you'll see that each of the professionals typically contributes to an effective technology program. Basically, engineers are involved in doing design, creating, producing, establishing, planning, analyzing, modifying. The professionals who use the knowledge of the mathematical and natural sciences and apply that knowledge. Engineering technicians apply, implement, conduct, measure, and test. They're professionals who use scientific and engineering knowledge and methods combined with technical skills in support of engineering activities. And the professionals or the technology managers plan, manage, and achieve goals. So they typically use project management, operations management, finance, personnel, and resource management in support of operations. In this Venn diagram, you can see some specific types of activities or responsibilities or roles for each of the professionals. For the clinical engineer, it includes the technology evaluation, data analysis, systems, environment, and process design, system and device lifecycle management, standards interpretation, risk management. In the biomedical engineering technicians includes typically test and measurement, calibration, adjustment, troubleshooting, installation, configuration, conformance with policies, procedures, and safety requirements. And for the healthcare technology manager includes operations management, project management, finance, personnel resources, supplier and quality management. Some of the new skills and abilities that we'll need to acquire among these professionals include strategic planning, project management, vendor and contracts management, analytics, evaluation of newly supported technologies. Are they safe, effective, resilient? Systems of systems management. Quality management systems is an important one, and it will will grow to play a major role, a major part of our activities, and a major role in HDM services. Incident and problem management, risk and security management, and continuity management. Do we have redundant and resilient systems and other specialized services? So this graphic is meant to illustrate some of the capabilities that health technology management needs to embrace if it's successfully to collaborate with IT in the future and fully support these new health technologies. So the traditional pillars of clinical engineering and IE using common practices to support these new converged technologies. And some of the common elements that go into effective support include these kinds of services that are embracing the pillars. So we need to consider adopting quality management systems that address both effective the service management and quality management for both or for these hybrid systems, for these hybrid systems. So for many in the workforce, particularly in technology-related industries like ours, education will not be something you'll ever complete. You're going to have to commit to continuous education if you want to remain relevant. And so that involves getting your not just your degrees. Completion of your degree is no longer sufficient. You're going to need to have continuous education through college and university-based programs, certificate programs, and other specialty programs. So education in your new role is going to be required as those traditional roles change and previously required skills and expertise become obsolete. So the new technologies for supporting are evolving at such a rate that what you learn today will likely be quite different from what you need to know to do your job 5 years from now. So again, the continuous education is important. This is just a graphic that illustrates career paths available for clinical engineering and HTM professionals. This shows clinical engineers can typically go in one of two directions. They can evolve either into subject matter experts, special expertise in areas like systems engineering or cybersecurity, or they can become supervisors, managers, and ultimately move into the C-suite. So there's a management track. When it, with respect to the biomedical engineering technicians, they're typically have to start with a certificate or an associate's degree, and similarly can either move into become subject matter experts in particular areas, particular technologies, or they may elect to move into a management track. They also, some may elect to transition from biomedical engineering technology, get a degree in engineering, and move into the clinical engineering track. Technology management professionals generally are into that track, and also you'll see some engineers moving into or technicians moving into that track as well, the technology management track. And there also is going to be some crossover between the HTM professionals, clinical engineering, and HTM professionals in IT. So finally, to summarize, the rapid evolution of the medical and information and communication and other technologies are going to continue to force a redefinition of what's considered an appropriate support service. The medical devices and systems we're dealing with and the locations that we're dealing with them in are likely to look radically different in 5 years from what we see today. So the technology is changing, and the venues in which we operate are likely to change. Again, you're going to have a lot more care delivered, to directly to the patient, maybe at at home, at work, and such. This means that those who manufacture medical devices and those of us who support medical devices must be prepared if we're to have any hope of remaining relevant. Evolving technology is a steamroller that even now is changing the healthcare delivery landscape, and all of us know that all of us should know that we have a short time to decide whether we want to be part of the steamroller or part of the road. So this is a brief summary of some of the steps that clinical engineers and health technology management community needs to support in their course reset. Oh, I apologize. I think, hold on. We need to consider how to redefine roles that were originally defined decades ago. And identify education and skills that will be necessary to move into those redefined roles. And we need to work with the industry to define new guides and standards that facilitate collaboration between support services, ensure future services meet those needs. And finally, we need to identify and work with other stakeholders in their organizations to further define effective roles and relationships. And that concludes my the formal part of the presentation. As Guy mentioned, there is an article on which much of this presentation was based that was published in June 2019 and is available. It's a free download, one of the ones that Amy makes available for free. I'll make sure that Colleen has the URL if she doesn't have it already to make so that you can download a copy of the article and look at it more closely at your leisure. With that, I will turn it back to Guy.
Excellent. Well, thanks, Steve. That was fantastic. I think you've clearly identified really the role of HTM has changed a bit. Let me turn on my video, get back to you again here. All right. So at this time, this is a great chance to submit questions to Steve and myself. We'll answer those as they come in. But I do have a few questions, as we're waiting. One of the presentations we had last week at another webinar event, one of the large health systems in the Midwest has grown pretty significantly through acquisition, and an effort to really do more with less. Their leadership team within the HTM department were able to evaluate utilization of the medical devices and strategically reduce the number of defibs by 30% across their entire fleet. When you think about that and you think about the skill sets that HTM should be investing in to help evaluate utilization, make decisions in capital planning, where should you go? What skill sets are going to be required for that type of exercise?
Yeah, cool. And I know we've kind of touched on this the topic before, and I thought I indicated I thought this is a really a good question that could take a whole course to cover. But just briefly, some of the things that we really need to do ensure we cover. I touched on some in the presentation is that we need to improve our skills in terms of problem definition, data collection, and analytics and analysis of the data that we collect, particularly in areas like acquisition, utilization, and maintenance. So, with respect to the capital spend, we need to, we and the organizations we work with have to take a more strategic approach toward their technology selection and acquisition, and we really should be proactive in getting involved in that. We should ensure that there's, whenever new technology or new equipment is requested, that there's appropriate justification made for that equipment. Those new acquisitions, it should be required, that justification should be required, it should be documented, and we need to ensure that whatever is put in there in terms of the justification, that it's measurable. So after the fact, we can go back and say, did this acquisition meet the needs that were stated, or the objectives that were stated in the request process, or the request for the technology? We need to be able to collect data on the utilization, and also look at other justification claims to verify those acquisitions have met the stated objectives. We need to also ensure going forward that we adopt our process, the data we collect, the process that we use in analyzing it, to ensure that we improve that process as time goes on. We become more effective. But these are all things that we. As clinical, in 45 years, we've collected a lot of data in our industry, and unfortunately, a significant amount of that data has really never been used, not in a way it could have been. And we need to get a lot better at collecting the right data and learning how to analyze it effectively to come up with solutions to things like utilization and the proper acquisition of technology.
Excellent. One of our customers that we spoke to last week mentioned that because of COVID, there's a great deal of remote monitoring, remote care being delivered, and many of their patients actually are coming from out of state through as far away as Alaska and even further, it sounded like. When you think about the technologies, healthcare technologies are becoming more capable, more connected, more interoperable. The areas you mentioned, telecom, medical technology, and information technology. How can leaders take this opportunity really to bridge the gap with health IT and take center stage to help with the maintenance and support of remote medical devices and ensure proper collaboration?
Well, first of all, we need to understand the trends that are taking place to the degree we can anticipate the trends in terms of what are the technologies that are going to be acquired, and where's your industry, where's the industry and where's the use of technology going, particularly, of course, at your institution. And then you need to be become very you need to be proactive in engaging the people in IT and telecommunications to ensure that you're in a position to develop the services that are going to be appropriate for these technologies. Again, often whether it's the fact they're remote technologies or just new technologies, they're going to be quite different often than the ones that we've traditionally dealt with. And again, that whole point that I hope people come across or understand is that new technologies support needs will dictate the nature of future HTM support services and the professionals that are going to provide them. So it's important to again develop, ensure that you've established the collaboration, develop the skills, develop the appropriate soft skills in terms of dealing with the other stakeholders in IT and telecommunications and others in cyber and risk management and such, and technology acquisition. And I will put a plug in too for, I know you're aware of it, and I think probably many in the audience may be aware of it, that ACC, Amy, and HIMSS have collaborated on the Health Technology Alliance. One of the things that that group is doing, the Health Technology Alliance is doing, is putting together toolkits to address many of these kinds of issues that will help facilitate some of this collaboration and identify, again, some of the skills that are required and just how to be more effective at doing the collaboration.
Excellent. That's great. And it's great to see additional support and initiatives underway that help with that. I'll ask the last question, then we'll open it up to the questions. We've got a lot of questions coming in from the audience. So when I think about the HTM clinical engineering role, it's just so well positioned to take center stage across this cross-sectional clinical engineering biomedical space, moving from discrete systems to systems of systems, connecting the dots across the organization. If you are a new biomed clinical engineer entering the field, what career paths would you explore to really make the most out of your field and your profession?
Sure, and I think this is a great time for someone to be entering the field in terms of, I think I've shared with you that I think it's, these are exciting times. I think this period in our industry represents probably the most exciting time in the 45 years that I've been in the field. And because I think many of these technologies that we're talking about are going to be transformational. They're going to allow us to reach a broader spectrum of the public or more of the public with higher quality care if we do an effective job in selecting the right technologies, and if we also do the right job in appropriately supporting them or supporting them effectively. I believe we should be at the heart of that acquisition and support process. In the paths we've talked about are, one can consider our engineering technician or technology manager. And I think, the first thing I do would be to, consider what are your particular proclivities and abilities, where do they naturally lay, and look at one of these three careers. And again, by the way, you're not locked in. One starts out as a clinical engineer, they can move to technology manager. If one starts out as a BMET with the appropriate training, education, they can move to engineer, if that's or technology manager. So, but consider where your particular proclivities and abilities are, your natural abilities, and again, I think they can be rewarding. But look into the one of these three, and you should follow again what your proclivities and your abilities would lead you to.
Excellent. Well, I'll keep going through some questions, and the ones we don't get to, we'll make sure we'll follow up with you directly. But thank you so much for submitting all these questions. The next one has to do with more of the regulatory bodies. It mentions that Joint Commission, CMS, sometimes are invested in an old paradigm, in the old HTM paradigm. If you agree, and you might not, what would you recommend we do to help advance their outlook on really what the field's potential could be and how to provide us the flexibility to move forward?
Well, one of the things I would do would be to work with, both, reach out to these organizations and, provide them, they do have advisory panels. They do have, advisory groups that you may have an opportunity to sit on. I would certainly let them know your opinion. The other thing I would do would be to work with organizations like ACCE and AMI, and in particular, and maybe also HIMSS too, because these organizations are often looked to by the regulators and the accreditors, for their expertise. And these organizations like AMI develop standards. And so I would look to participate in things like the AMI standards committees, which help develop standards that ultimately may be adopted by the regulators. So the Quality Management Standard 1345 is developed under the auspices of AMI. They have the Equipment Management Program that's cited by CMS and cited by Joint Commission and DNV are all developed based on standards that were produced by AMI. So I would work with those organizations to make your concerns known, and also to participate where you can in providing expertise, some practical experience that they can then share with those who are developing the regulations, and the standards. Again, like CMS and the FDA and the Joint Commissions and DNV.
Excellent. A couple more questions. One of the questions comes in that, and I'll just read it. It basically says, sometimes you run into situations where you run across a piece of equipment and there's a note that says, this equipment is broken. How do you help bridge the gap with nurses, clinical staff to help create more of a partnership on creating a great patient experience and ensure that that equipment is being used to this highest function? How do you bridge that gap with the clinical staff, with the nursing staff?
Well, one of the things, of course, education, making sure that they understand, what's the proper process and why it's important for you to have more than, it's broken. Electronic medical records weren't very popular when they were first put in place, because it required people to do something different, provide more information perhaps than they, normally would have otherwise, or in a different way. But eventually people came around to see the benefits of the electronic medical records. And they can also, if you've got to be able to, in the education process, educate them so they understand the benefits of, why it's important to have more information. The bottom line is, if all you get is it's broken, it becomes very difficult for them to, for you to, fully address these issues, these problems. Maybe there's a staff education problem that needs to take place, because it's, of the way that they're handling the device. So education, both, what's the proper procedure, but also education as to why it's important to provide this information and how it can help ensure that they've, got the technology that they need, when they need it, and that it's safe and effective.
Excellent. The last question we have time for is a broader question. I think about the diverse skill sets that clinical engineering has to have in order to lead and coordinate activities and projects and initiatives across diverse departments: IT, purchasing, supply chain, finance, risk management. This question has to do with the relationships with functions other than IT and the value those relationships bring to clinical engineering HTM professionals. and the value that clinical engineering professionals can bring those functions. So think about purchasing, supply chain, finance, risk management.
Right.
How can we play a part in there?
We need to, we have a general understanding in terms of what's the process for acquiring the technologies, effectively supporting the technologies, and everywhere in that acquisition and that support process, there are places where these other stakeholders, need and should be playing need to play a role, can and should be playing a role. And so again, engaging them in the appropriate the processes, educating them as to the why it's important, is what you need to be doing. So it's educating about what you're looking for from them in terms of their participation, and why it's important that they participate. What's the benefit that is gained from that participation? So how does it make the healthcare better by their that participation? And that's certainly you can make a case with all of these stakeholders: the risk management, the supply chain, the facilities. They all at various times and various roles should at least often will play at least an ad hoc role in these processes. And again, so it has to do with showing where they can benefit, and how they can do it, how they can work with you to do that.
Excellent. Well, Steve, I think the collaboration and the opportunity is really all ours, right? This is an opportunity to step up and continue to bridge gaps and reach out to other parts of the organization and really drive change. So I want to thank you.
It's exciting. Yeah, it's always exciting. So go out and don't be intimidated by it. It's again, exciting opportunities, and I think we can certainly play a role in making certainly healthcare and the world a better place. So.
Absolutely. Couldn't have said it better myself.